Which of the following is most likely cause of these findings? All right, 2-year-old neonate is brought to the two-day-year-old neonate is brought to the pediatrician due to difficulty in feeding and excessive drooling. Baby has respiratory distress, episodes of choking and coughing during feeding attempts. The mother had polyhydramnios during pregnancy. NG tube is passed but cannot advance. Okay. If you can't pass the NG tube, so I was just reviewing like duodenal atresia the other day, and it doesn't say the bilious vomiting or anything like that. So that was my first thought, but I don't think that's correct. It's not Hirschsprung's, that's the other end. It's not pyloric stenosis. It's not GERD. I think it has to be esophageal atresia.
Great. Yeah. So, esophageal atresia, right? Excessive drooling, also respiratory distress, because if it has atresia, then probably it has some kind of tracheoesophageal fistula somewhere too,
Mm-hmm.
right? So, probably that's why kiddo's having respiratory distress, that some of the saliva is leaking in, right, into the
Okay.
lungs, which is not good. GERD, right? That's going to be, reflux up, things like that, right? Pyloric stenosis, usually it takes a little bit of time for pyloric stenosis to happen because the muscle is what contracts down, and so it takes 8 weeks of age, but it's projectile vomiting, and
And
you
that's
can,
the olive, the
yep,
mass, right? The
yep, you can
olive-like mass. Okay.
Yep, you can feel that, the kind of where that muscle is. You can palpate the stomach and feel it. That's that olive shape, kind of what they're talking about. Hirschsprung's, like you said, right? That's at the
Mm-hmm.
other end. Duodenal atresia is a double bubble sign, is usually what they say. So, do you know why you have a double bubble sign? I'm just curious.
Um, I'm just thinking because the part of the maybe I'm thinking wrong of duodenal atresia. I mean, no, I don't think well, I know it's air
Yeah. So practically
in
with duodenal,
intestines.
so you have air within the stomach, which is one bubble, and the other bubble is from the pyloric to the duodenal atresia. Does that make sense?
Okay.
So
Yes, that
you
makes
see
sense.
two air bubbles, right? Because usually you should only see your stomach bubble, right? But if you have a
Yes.
atresia, you have an extra bubble, so that's why they call it double bubble sign, right?
Okay.
But yeah, an NG2, right? It goes to the stomach, right? It shouldn't go past the stomach, so it doesn't make sense when they give you an NG2 test. It doesn't really test that. So, like you said, also you might have like bilious vomiting and things like that. So good.